more years out, but steps need to be taken today to make that future a reality. Now let's begin with the pre-pandemic backdrop. Okay, so before the pandemic, telehealth momentum was gaining steadily, but on the whole, very few physicians and patients had actually adopted the technology. Among both groups, more than 2/3 of people said that they'd be willing to try it, but as you can see here, only small fractions of them actually had. Why the gap? Several barriers, both structural and secular in nature, were to blame. Among providers, some of the largest perceived barriers included regulatory complexities with respect to licensing, reimbursement, patient consent, for example. All of these created challenges for providers in knowing what regulations to abide by. Few types of telehealth services were eligible for reimbursement, and those that weren't always reimbursed at economical rates. Physicians were also weary of potential cybersecurity risks. And as with most other health IT solutions, they questioned the interoperability of it. Another common perceived risk was their ability to deliver high quality care through a virtual interface. But again, many had not tried the technology yet. Barriers to consumer adoption were largely related, the two biggest being one, limited access, for example, by their providers not offering it, or limited insurance coverage, and two, lack of awareness of the telehealth options that were made available to them. Among those who did have access and were aware of it, questions about the quality of care and data privacy were commonly cited reasons for not adopting the technology. Now, fast forward to 2020, when the novel coronavirus hits the US. The pandemic caused people to seek medical care at unprecedented rates, which made in-person visits become dangerous. Clinics had to respond by reducing their hours, staff, types of care they provided. Some even temporarily closed their doors. Emergency rooms grew overcrowded as legitimate coronavirus cases rose, and also as low-risk patients with no other options were diverted there. And patients with non-coronavirus related health concerns had few viable options to seek care. Therefore, telehealth became necessary to ensure uninterrupted access to meet patients' needs, minimize healthcare worker exposure, and contribute to the overall effort of flattening the curve. Now, to help relieve these issues, the federal and several state governments took action to temporarily remove some of those traditional regulatory and reimbursement barriers that had held back telehealth adoption. This led to a synergistic effect between both necessity and now opportunity, driving rapid adoption among both patients and providers. As shown here, by May, physician adoption had tripled from pre-coronavirus levels. So at that time, close to 70% of US physicians were offering telehealth. And of those that did, most had shifted more than half of their practice volume online. For context, before the pandemic, the vast majority were conducting less than 25% of visits online. Utilization of telehealth services also rose sharply, especially in the realm of ambulatory care. For example, at both Cleveland Clinic and NYU Langone, virtual share visits went from just single digits in March to over 75% by April. And also, importantly, at NYU, for example, half of the virtual urgent care visits and 80% of the non-urgent virtual visits were completely unrelated to coronavirus, an encouraging sign that patients were actively utilizing virtual care for other health needs. Now, it's important to realize that we're not just talking about impressive upticks in adoption and utilization. We're also talking about just how rapidly they happened. Just look at this stat. In 5 months, Mass General Brigham clinicians completed more than 1 million telehealth visits. This compares to the 9 and 10 years it took MDLive and Teladoc, respectively, to do the same. Payers also played an important role in stemming the tide by partnering with telehealth providers and extending services as covered benefits to their members. This was particularly notable in specialty care realms like behavioral and mental health, which suffer from more acute supply constraints than the rest of the healthcare market. Taken together, the responses of the government, providers, and payers greatly improved consumers' access to affordable telehealth services during a time of significant need. And by August, more than 70% of Americans were using telehealth. That's nearly 9 times pre-pandemic levels. Now, as the nation begins to recover from the pandemic and clinics reopen for in-person visits, it's important to recognize that telehealth utilization may moderate a bit, but newly formed attitudes about it are much less likely to. As physicians and patients become stronger believers in the technology, there will be increased pressure to address some of those longer-term barriers, for example, by making some of these temporary relaxations introduced during coronavirus more permanent. In fact, there's already early evidence that providers' attitudes are changing. Let's just remind ourselves of how providers felt before the pandemic. In a 2019 survey of physicians, nearly 60% said telehealth was not at all important to them. Now, in more recent surveys, since the pandemic, the vast majority see it as extremely important, and nearly 100% of them want to operate going forward. Consumer attitudes are growing more favorable as well. Over 90% of those using telehealth during the pandemic have been satisfied with their experience and are even more satisfied with their providers for even offering virtual services. The vast majority also want to continue using telehealth, which they now see as an indispensable part of the healthcare system. But interestingly, half of US patients said that they'd switch providers if their provider didn't offer virtual care, making the technology a super important retention lever for providers to consider going forward. In this recovery period, winning telehealth platforms will be the ones that meet all the wants and needs of both patients and providers. Now, from the provider standpoint, an ideal telehealth system would automate administrative tasks, seamlessly share data with other enterprise systems, protect patient information, be easy to set up, use, and integrate into their existing workflows, and provide an end-to-end digital interface for their patients. Patients, on the other hand, don't want to have to download applications, but they do want the ability to select the physician they see and to book appointments online, to experience quick, convenient service at low out-of-pocket costs, and do so for all types of care needs. Now, I'll quickly walk through some examples of what these features might look like. To be clear, I'm not saying these exact companies will be the quote winners, but I am saying that they're already devising solutions to meet some of those wants and needs. With respect to task automation, BrightMD is an asynchronous telehealth platform that automates patient intake, clinical workflows, and administrative tasks like charting, order entry, coding, and billing to make these virtual visits more productive. The company actually says this approach can reduce a 20-minute appointment to just 2 minutes. That's huge. Those saved minutes mean providers can deliver more episodes of revenue-generating care per shift, and it leaves them much more time to spend with patients who have more complex conditions. Greater interoperability is desired across all health IT solutions, telehealth being no exception. And the goal of this is to get the right information to the right people at the right times so that it can be used to improve care and to provide accountability and performance metrics for quality standards and also reimbursement. Improved interoperability will therefore be required to make telehealth more of a mainstay. Last year, the American Telemedicine Association, with support from VitalNet, launched an industry-wide telehealth interoperability initiative to help drive that change. VitalNet has developed an interoperable enterprise platform that aggregates patient data across the entire telehealth continuum of care, making multi-provider access to patient data in multi-EHR environments much more transparent. Now, like all technology in the healthcare space, telemedicine solutions need to be HIPAA compliant to protect patient privacy. HIPAA compliance helps safeguard providers against potential security breaches or privacy violations, which could otherwise lead to significant fines and penalties or even lawsuits. During the pandemic, the government has said it'll temporarily turn a blind eye to the use of non-compliant systems like Skype or FaceTime, but it's only a matter of time before it reinstates its strict enforcement policy. So providers looking to implement longer-term telehealth programs will need to seek out HIPAA-compliant systems like the one shown here. Luma Health's telehealth solutions allow providers to perform HIPAA-compliant virtual visits and also to communicate easily and securely with patients between visits through HIPAA-compliant text messaging. To be maximally effective, telehealth technologies must also be super easy to use for both patients and providers. The best solutions are easy for providers to set up and deploy and integrate into their workflow, and at least as easy for patients to use as the mobile apps that they already use every day. But recent surveys indicate that when it comes to telehealth, patients don't want to have to download any additional apps or software. So the trick is finding solutions that operate similarly and as intuitively as consumer apps that aren't actually apps. Beam Health is a good example. It says its telemedicine platform can be set up for providers in just 24 hours and with very little training required. At the same time, patients don't need to download anything to use it. Instead, they simply receive a text message informing them that their appointment is ready to begin, and they simply click the link to open the video visit in their web browser. To improve the user experience, providers will look to combine all their patients' digital touchpoints across the in and out of office experience into a single digital access point. This approach is becoming known as the digital front door. Beyond user friendliness, patients tend to want two specific features within these digital front doors. First, to allow them to select the physician they'd like to see via virtual visit, and two, to schedule those appointments directly online. LifeLink is a good example. Through its conversational AI-based patient engagement platform, LifeLink offers intuitive chat-based experiences to guide patients through everything from care navigation and booking to triage and intake to follow-ups and referrals and more. Now, patients care a lot about convenience and efficiency. They don't want to experience long wait times, and they expect quick turnarounds from their interactions. They're also sensitive to out-of-pocket costs. To the extent that they'll be partially responsible for the cost of telehealth visits after the pandemic, consumers will likely gravitate towards lower cost solutions. K-Health answers both of these needs. Its chat-based triaging tool is completely free, but if users wish to chat with a doctor following, it's a flat $19. Primary care memberships are priced even lower at $9 a month. The timeliness of these hybrid chatbot and live physician interactions is frequently cited throughout the company's reviews, like the one shown here, which says it took a patient only 30 minutes to register, fill out symptoms, chat with the doctor, and get prescriptions sent over. The last thing patients seem to want in a telehealth provider is the flexibility to deliver all different types of care as that patient's health needs change. Doctor on Demand is a great example of this. In fact, the company projects that more than half of its 2020 growth will come from the expansion of its virtual primary care offering, which enables health plans and employers to deliver cost-efficient, comprehensive virtual care, which is inclusive of integrated behavioral health, 24/7 everyday and urgent care, and chronic care management. So while there are a lot of solutions out there that fulfill one or some of these needs, there are very, very few that fulfill all of them. But there's certainly a race underway to get there, and this pandemic will hasten it. Now, while we don't have a crystal ball to see what telehealth looks like 5 or more years from now, we can look at some of the trends we're beginning to see pick up steam to help inform our predictions. And what those trends tell us is that there's going to be a lot of activity converging towards a completely new model of care. There will be a lot of different ways to get there, but change will happen fast. And those who wish to win will need to be thinking about these things now and be willing to move swiftly. Telehealth businesses are already eagerly expanding the breadth of their services, their tech solutions, and their end markets. For example, Hims and Hers and Lemonade Health both recently expanded their services to provide more comprehensive care to their customers. Hims and Hers added mental health, and Lemonade added services for asthma, hypertension, and type 2 diabetes. We expect a continuation of this trend as time progresses. At the same time, we're seeing an emergence of new entrants like EHR vendors like Modernizing Medicine and Dr. Chrono launching virtual visit capabilities, and medical device companies like Echo and DermTech launching telehealth platforms that integrate their devices, and many more examples. We also expect this trend to continue as companies with established customer bases and strong technological capabilities seek to help fill heightened demand from patients and providers. Of course, to fund these efforts, investments will continue to rise. 2020 is already a record-setting year for telehealth deals in dollars. And on an annualized run rate, telehealth startups are on a pace to raise an unprecedented $8.9 billion this year. Going forward, new entrants will likely need to raise capital as they seek market inroads, and incumbents will likely continue to raise capital to both expand into new products, service lines, and end markets, but also to invest more heavily in marketing to establish points of differentiation and to generate brand loyalty. Another thing to note is corporate investments might also rise as a broadening array of healthcare stakeholders have become increasingly interested in buying, building, and partnering in telehealth. And equity investments are a low-cost conduit to evaluate those options. Business relationships have been on a steady incline for several years now, with much of 2020's activity, of course, centered around the pandemic. But provided key stakeholders like providers, payers, and patients continue to derive benefits from these arrangements, a new wave of business relationships could reasonably follow. Providers and payers will likely be the most active strategic partners since they have the most direct access to patients, though health IT vendors catering to them will likely be right behind. Providers will also have to keep a watchful eye on partnerships emerging between retail pharmacy players like Walgreens and Walmart, CBS, who are increasingly interested in offering virtual care services. As telehealth companies expand their services, we also expect interesting partnerships to emerge in the connected device and at-home testing spaces. In a similar vein, we expect M&A activity to accelerate as the industry matures, but especially in the wake of the recently announced mega merger between Teladoc and Livongo. Now, it still has to close, and there's still a lot left up in the air, but the recent announcement that Teladoc and Livongo are merging sends a powerful signal about where virtual care can go. When you add the two companies, what you get is an integrated, consumer-centric virtual care experience that sits across acute, episodic, and chronic care, and also across all sites of care, including the home, retail environment, the hospital, etc. And it's also powered by personalized real-time data analytics that can engage the right provider and care teams at the right time to improve outcomes at high efficiency and lower cost. So as a full stack virtual care vendor, the new Teladoc is uniquely positioned to morph into a comprehensive virtual care company that could ultimately replace a big portion of in-person visits. It won't happen overnight, of course, but it will become more likely as the company streamlines its messaging, adds more condition-specific care pathways, connected devices, and potentially at-home diagnostics to its portfolio, and as it brings on additional customer accounts. As I alluded to earlier, the Teladoc deal will likely increase M&A activity in the digital and virtual care space. Not only as the newly merged entity continues to do acquisitions of its own, which it has said it will do, but also as other companies look to gain a foothold in the space. Now, if you haven't already taken the poll, I'd love to get your thoughts on where M&A activity might take place. So please navigate to the poll tab on the right of your screen and respond to this one question when you have a moment. We believe that horizontal consolidation will likely occur in specialty areas of medicine where smaller businesses will have to fight against share loss from these larger, more established players with rapidly expanding services. but it could also bring together different specialties or different telehealth modalities to create more comprehensive and more versatile platforms. Many of the top teledoc competitors, for example, are rather behind in implementing chronic care management, remote monitoring and diagnostics, digital therapeutics, health coaching, just to name a few examples. So there's an opportunity for them to potentially use M&A to fill all of those gaps. Vertical integration should also continue, especially as payers seek to bring a broader array of consumer-centric, digitally enabled care services under their umbrella. And also as telehealth vendors incorporate additional digital front door and automated workflow solutions. Some of the specific segments we expect to benefit from M&A activity in the near term include diabetes management and other forms of chronic care management, virtual physical therapy, and mental and behavioral health. Livongo's biggest competitor, Omada Health, for example, which recently acquired virtual physical therapy startup Bizera, could potentially be an attractive, though a likely pricey target. On the other hand, it could be an active acquirer looking for a virtual care asset. Speaking of virtual physical therapy, we expect that to be another focal point for M&A as a more convenient, cost-effective, and importantly, non-opioid approach to managing chronic pain. Mental and behavioral health has also grown in popularity, and it's a critical component for integrated virtual primary care, which is the first step towards more comprehensive care. So mental health focused telehealth startups like Talkspace, Lyra Health, Ginger, or Mindstrong could be attractive targets. And with a lot of promising companies operating in these areas, there will be a lot of opportunities for M&A. But we expect this activity to move at a quick clip, with top tier assets being acquired sooner versus later. So companies that don't act quickly risk falling too far behind. In time, these trends will converge upon an entirely new model of care, where telehealth is completely integrated, interoperable component alongside in-person care. Telehealth is comprehensive, covering primary, behavioral, preventive, and chronic care services. Telehealth serves as that single digital access point for all patient care needs. And telehealth enables these personalized longitudinal care that improves patient satisfaction, engagement, and ultimately health outcomes. Now, just think of the possibilities under this model. The potential is pretty spectacular. And while the thought of getting there may be equally as daunting as it is exciting, the point is that first movers in the industry are already paving the way towards this new model. And as their influence over the patient experience expands, patients will increasingly come to expect to be cared for this way. And any company with a stake in the future of patient care should be focused on working towards this new model. And they should be thinking about what they can do today to make that happen. With that, I'll conclude the presentation. Thank you all for joining. And again, my name is Marissa, and I'll be available via the Brella app if any of you would like to discuss any of this further. Enjoy the rest of the conference.